Today is Tuesday, October 25th. It's been about a month since I've given any sort of update. I've been a little busy with graduate school and had my first final recently, so that kept me occupied. It was a monster of a final, really. Well, I'm going to give a medication update because I know it's been a while. I've been focusing a lot of my videos on talking about transitioning to a new job and starting graduate school for speech and language pathology, but uh, a lot of my channel is also focused on mental health and mental health medication and coping skills because I do have cerebral palsy, major depressive disorder, and inattentive ADHD, as well as generalized anxiety. So I've tried like a million different medications for all of these conditions, and I've talked about them and reviewed them all on my channel if you want to check those out. For the past couple of months, I have been on uh, 10 milligrams of the antidepressant Trintellix, and I've also been taking the stimulant medication Mydayis for the inattentive ADHD. I started off on 12.5 milligrams of Mydayis, and then a few months later, my provider brought the dose up to 25 milligrams, but I found that it was making me nauseous. So then I asked her to lower it, and sure enough, the nausea subsided and it went away after she lowered it back to the 12.5 milligrams. If you tend to be very sensitive to medication like I am, I always suggest that you start on the lowest dose and stay on the lowest dose for as long as possible. And if you find that you need to raise the dose, do it in small increments, and that's what I have found that helps. And if raising the dose causes some sort of nausea or some sort of side effects that I don't want to deal with, then I just go back to my previous dosage, which is what I did this recently with the Mydayis. So as of right now, I'm on the 10 milligrams of Trintellix and 12.5 milligrams of Mydayis, which has been working fine. However, I do have cerebral palsy, and one of the side effects is that I have an exaggerated startle reflex. And I've talked about that in previous videos, and I've found that stimulant medication makes the startle reflex worse. And so I'm going to come off the stimulant and I'm going to try a new non-stimulant medication for the ADHD. I have tried Wellbutrin and Strattera before, but I had some weird side effects. I think one of them I had like an allergic reaction to, and the other one was just making me really nauseous. But the my provider said there's another medication. I'm looking at the bottle right now. It's called Quelbree, and she prescribed 150 milligrams. It is a non-stimulant medication, so I'm assuming it's similar to Strattera or Wellbutrin, but might be classified as a different type of drug. I'm not sure. But this morning I took the stimulant, the Mydayis, and I have 2 capsules left, which is perfect because I will be taking it uh, tomorrow, which is Wednesday, and I'll be taking it Thursday. And then once I run out of the Mydayis, that's when I want to start on this qelbree, which is going to be Friday. So if I do end up experiencing any sort of withdrawal symptoms, which does happen when you're switching medications or when you abruptly stop a medication, particularly a non-stimulant medication, some of the withdrawal symptoms I've experienced are like depression, irritability, lethargy. Uh, there's a bunch of different symptoms, and it's different for everybody, but you will typically experience some withdrawal symptoms if you just abruptly stop taking it. So that's why I figured I'm going to take the last capsule on Thursday, and then I'm going to take my first capsule of Quelbree on Friday. So if I do end up experiencing any of these uh, uncomfortable withdrawal symptoms, I can deal with them on the weekend, Saturday and Sunday, which is typically when I have less things to worry about throughout the day, like school and work and all that. Um, but yeah, I think that I have so many comorbid conditions that don't interact well with one another, and adding like the startle reflex and cerebral palsy symptoms to my already existing mental health issues like depression and anxiety and ADHD makes it really difficult to be able to find a combination of medication that will work for me and will treat all of these symptoms with minimal side effects. So that is why I'm trying to go back to a non-stimulant medication, because I have found that this is like the third stimulant medication I've tried. I think I've tried Ritalin in the past, and I can't remember the name of the other one, but I have found that it does um, exacerbate my anxiety a little bit. So typically, when I'm on stimulants, I do feel a little bit more anxious. It's nothing that I can't handle, but I think that what is really bothering me is the startle reflex, and I'm just trying to do what I can to kind of try and diminish that. And I'm going to stay on the 10 milligrams of, um, I can't even focus right now while I'm talking. I'm going to stay on the 10 milligrams of the Trintellix, and then take up the Quelbree. So I don't know how those two medications will interact with each other, but once I've been on them for about a week or two, I'll come back on here and update as to the symptoms of my ADHD, my depression, anxiety, and whether coming off of the stimulant medication has helped diminish my startle reflex. Um, there is another treatment that I want to try, and I think I might have talked about this in the previous video. It's called TMS, so transcranial magnetic stimulation. It's kind of like they hook up little nodes to your brain and send electrical impulses that are not painful at all. It's not like shock therapy or anything, but it's supposed to help stimulate the parts of the brain that are said to be less active in people who have depression and anxiety. And it's an alternative to medication, because I feel like I've been on medication now for a while, for a couple of years, and I've tried a bunch of different combinations. So maybe this less traditional method of TMS will help alleviate some of those depressive and anxious symptoms that I haven't been able to help with by taking the medication. And once I start working at my new job as an SLP, which should be within a week or two, because they're getting hired for the district is, especially on a waiver, does take some time. So they're still kind of reviewing that and going through the process of trying to get my waiver approved before I can start working. So it might be another week or two. I will have an insurance with a much lower copay, so then I should be able to afford the TMS treatment. So that's the plan. Um, as far as any other updates, I think I've just been really busy with school and graduate school. Even though I am in a part-time program, it's still kind of a lot. So I will try to come on here and update more frequently if I am able to, especially because I want to keep track of how this new medication is affecting me. That's one of the reasons why I started this vlog, to kind of document and keep track of like side effects and what medication combinations have been effective and which ones haven't. Um, so I'll try to come on here and update in about a week or two after I've been on the Quelbree and Trintellix for a while. And yeah, that's it for now.